Hello, my name is Joanne Hovey, Executive Product Specialist for Dentsply Sirona. Today I'd like to talk to you about the care and maintenance of the Cavitron Unit and Cavitron inserts. It's always important to follow the directions for use to protect your investment and make sure that you are following the proper infection control protocols. Did you know 90% of patients' time will be spent with the hygienist? Therefore, it is important that their time spent with you is a positive experience. Additionally, a typical patient is worth about $1,000 yearly to your practice. Just so you know, the patients you satisfy are worth thousands to your practice, but the patients you disappoint are worth tenfold in revenue losses. This is an interesting slide. It shows you the history of Cavitron and its 60 years of technological innovation. As you can see, Cavitrons have come a long way. The benefits of owning the Cavitron technology are best-in-class products, experienced technicians, extensive warranty, and the list goes on. So now let's dig into the actual maintenance of your unit. We have various styles of units, but for the purposes of this video, we will be showing you the Cavitron Plus and the Cavitron 300 as examples. For the care of the external surface of your unit, on the Cavitron 300, first, you need to lock the Cavitron screen. Next, we will suggest that you use a surface disinfectant with the least amount of alcohol content for proper infection control. The product we suggest and support is our Volo wipes. However, you can use any surface disinfectant that is a broad-spectrum hospital-grade water-based disinfectant solution. Some alcohol-based disinfectant solutions may be harmful and discolor the plastic materials. This step-by-step video clip will walk you through the process.
A two-step cleaning process is recommended when visible soil and debris are present on environmental surfaces. The soil and debris must be cleaned prior to disinfecting the surface with a disinfectant wipe or spray. To prepare the unit for the next treatment session, utilize a disinfectant wipe or generously spray disinfectant solution on a clean cloth. Do not spray disinfectant solution directly on the system surfaces. Disinfect the surfaces of the cabinet, power cord, handpiece cable, tap-on foot pedal and cable assembly, and water supply lines.
Now let's talk about your water filters. Always check your water filter when the diagnostic light comes on. We recommend that you change your water filter on a monthly basis. As we discussed, here is the water filter guidelines. For both municipal or soft water, it is recommended you change the water filter once a month. For well water, hard water, and bottled water systems, it is recommended that you change the filter twice a month. Next, you will see the procedure on how to do this.
When the waterline filter becomes discolored, the filter should be replaced to prevent reduced water flow to the Cavitron Plus system. This should be checked and/or replaced monthly. To change the water filter, begin by verifying that the system is turned off. Disconnect the water supply hose from the dental office water supply. If a quick disconnect connector is attached to the end of the hose, relieve the water pressure by pressing the tip of the connector in an appropriate container and drain the water. Grasp the fittings on either side of the filter disc and twist counterclockwise. Remove the filter section from either side of the water hose. Install the replacement filter onto the water hose fittings. The filter should be positioned to match up with the correct hose fitting. Hand tighten one hose fitting onto the filter in a clockwise direction. Tighten the second hose onto the filter in a clockwise direction. Reconnect the water supply line. Operate the unit to bleed the air and test for any leaks.
Along with your water filters, it's important that you take care of the physical water lines. You need to purge your water line on a regular daily basis. The recommended infection control guidelines are 2 minutes in the morning, 30 seconds in between each patient, and 2 minutes at the end of each day, as shown here.
To begin, remove the used Cavitron ultrasonic insert and secure it in a cassette or transport container. Hold the handpiece over a sink or drain and activate the purge control button. The The purge function will run for 2 minutes. This function will flush out any stagnant water that remained in the lines overnight and releases any air bubbles that may be trapped in the handpiece. Per the CDC recommended guidelines, the handpiece line should be purged for a total of 20 to 30 seconds in between each patient. This allows any patient material that may have entered the water lines to be flushed out. To interrupt the 2-minute purge cycle, after 30 seconds, press the purge control button again or simply press the tap-on foot pedal. After the purge cycle is complete, turn the system to the off position.
It is important to clean the water lines of your Cavitron on a weekly basis, as demonstrated here.
It is strongly recommended that the Cavitron scaling system be disinfected by chemically flushing the water lines with a 1 to 10 sodium hypochlorite solution at the end of each week. This can be accomplished by connecting this device to the Cavitron Dual Select dispensing system. Follow the steps listed in the Cavitron Plus ultrasonic scaling system directions for use manual.
The proper way to use your Steri-mate handpiece is to fill up the handle with water before inserting your Cavitron insert. Do not tip the Steri-mate on an angle, as this will allow air bubbles to enter and create hot spots that can cause damage to both the Steri-mate and the insert. Keep the Steri-mate completely upright to avoid this. It is recommended that you roll the O-ring across the bubble of water at the top of the Steri-mate, as shown in the next video, to lubricate it before placing it into the handle.
To prepare the unit for another treatment session, place the sterilized Steri-mate handpiece onto the handpiece cable assembly. Prepare the handpiece for use by holding the handpiece in a semi-upright position over a sink or drain. Depress the foot pedal until the water exits to release any air bubbles that may be trapped inside the handpiece. After opening a sterilized insert, lubricate the O-ring on the insert with water before placing it into the handpiece. Fully seat the insert with a gentle push-twist motion. Do not force the insert into place. Adjust the system controls according to the recommendations for the insert selected.
So now let's talk about the Cavitron Steri-mate handpieces. The CDC and the CDHBC recommends that all dental handpieces and other devices that may be attached to the air or water lines must be sterilized after each patient use. All devices must be cleaned, disinfected, and sterilized prior to each use. Following use, the Steri-mate should be reprocessed as soon as it is reasonably practical. First step is to remove the insert from the handpiece, then remove the handpiece from the cable, as shown.
After the purge cycle is complete, turn the system to the off position. Remove the Steri-mate handpiece from the unit. Contaminated instruments should be transported in instrument cassettes, trays with sides, or labeled containers with lids when cassettes are not an option. Occupational safety must be followed by clinicians to reduce the risk of sharps injuries and exposure to contaminated instruments. Instrument reprocessing plays an integral part in routine infection control procedures. Used instruments can harbor bacteria and bioburden and should be transported to the reprocessing area immediately after their use. The CDC's recommended guidelines for reprocessing of handpieces requires heat sterilization methods to sterilize handpieces and all devices that attach to air or water lines. It is important to follow the manufacturer's recommendations for cleaning, lubrication, and sterilization of handpieces being used. Once handpieces have been separated from instruments for reprocessing and the manufacturer's guidelines have been reviewed, reprocessing should begin to prevent any residue or contamination from drying on the device. Begin by removing any moist debris or residue on the Steri-mate handpiece by using a disposable disinfectant cleaning wipe like Volo wipes. Rinse the Steri-mate handpiece under running water. After cleaning the Steri-mate handpiece thoroughly, disinfect all surfaces of the handpiece by wiping with a disposable wipe in combination with a bactericidal, virucidal, and fungicidal instrument disinfection solution, observing the concentration rates and contact times. After disinfecting the handpiece, rinse under running water for 30 seconds. Dry the handpiece with a disposable towel. Steri-mate handpieces can be cleaned and disinfected in automated instrument washers. For cleaning and disinfection of these handpieces in an instrument washer disinfector, always follow the manufacturer's instructions for use for the unit and the instrument washer solution, making sure to observe the concentration rates and contact times, as well as the instrument washer's recommended cleaning and/or thermal high-level disinfection cycle. After the dry cycle is complete, always inspect for remaining debris. If debris is still visible, repeat the washer disinfector cycle. If utilizing cassettes for inserts or hand instruments, place the cassette in a paper to plastic steam sterilization pouch or sterilization wrap after ensuring the instruments are completely dry. After following the handpiece manufacturer's recommended cleaning and disinfecting guidelines, handpieces should be packaged in a sterilization paper to plastic pouch. If cassettes are not an option, place the instruments and/or inserts in a paper to plastic sterilization pouch. When loading an autoclave, follow the recommended guidelines for the unit being used for proper placement of cassettes and paper to plastic pouches. If a vertical sterilization pouch rack is being utilized, the pouches may be placed on end during the sterilization process, as seen here. If horizontal trays are used for loading cassettes and sterilization pouches, it is essential to follow the unit's manufacturer recommendations for placement of paper to plastic pouches. Follow the manufacturer's guidelines for the steps and use of the type of autoclave unit being used prior to starting the device. Allow the dry cycle to complete prior to emptying the items from the autoclave. If items are still wet, allow them to dry completely before storing.
For manual reprocessing, a link to further instruction will be provided at the end of this video. After reprocessing the Steri-mates, I have found that you need to leave them cool for approximately 45 minutes to an hour to allow them to fully reach room temperature so that there is absolutely no heat left that could potentially damage or warp the Steri-mates once you run cold water through them. It is recommended that you have an average of 3 Steri-mates per active Cavitron unit in your office. This will allow you the ability to have proper rotation. Always keep in mind 1 Steri-mate will be in use, 1 in the drawer ready for use, and 1 in the sterilizer. Next, let's review some troubleshooting items. If you find you have water leaking from your Steri-mate handle, the best solution is to change the O-ring on the insert. So in order to change a Cavitron O-ring, you want to ensure that you remove the old O-ring first. I like to use a little bit of a duller, more pointy instrument, and I grab underneath, and then I grab a pair of scissors and just clip the O-ring. Okay, so that will remove the old O-ring. Next, what you're going to do is you're going to take the O-ring tip tool, which is this guy here. You're going to place one of the black O-rings over top of the end here. That's a bit of a crunchy area, so it kind of condenses on itself. And you're going to put it back onto this tool as far back as you can go. Then you're going to take this and you're going to slide it up the insert stack to the top here, and then you're going to gently roll the O-ring into place, and then gently remove the tool from the back of the insert. Now always remember that when you're using a plastic area that you're going to place these insert O-rings on, you use a black O-ring. If that area was metal, like in our JetMates, you would then use a green O-ring. If you find there is water leaking from the insert tip, you need to call your service technician, as this usually indicates a solenoid issue. If your tips are heating up or the Steri-mate handle is slow to fill with water, you first want to check the water filter to see if it is clogged. Then check to see if you have been operating your unit in a constant boost mode from the foot pedal. Also, always ensure that your Steri-mate is filled with water prior to inserting your insert. A dry Steri-mate will create hot spots and therefore potential damage. Warranties need to be reviewed carefully so that you can understand the time frames for coverage on the individual items. The Cavitron Unit, 2 years. The Cavitron Plus Value Packs are 3 years. And the new Cavitron 300 Value Pack is 4 years. Cavitron Steri-mate handpieces are 6 months, and the Cavitron inserts are 90 days. My suggestion is always to inspect your units and components thoroughly upon receiving them so that you can deal with any warranty issues immediately. If you require a warranty repair, we recommend that you connect with the dealer whom you purchased the product from first before calling Dentsply Sirona. Next, we are going to review the care and maintenance of your Cavitron inserts. When a clinician is using ultrasonic inserts, monitoring and properly maintaining them is essential. This slide shows you the various parts of the Cavitron insert. The insert tip is unique to each one. Most inserts come in two different styles of finger grips, both the fit grip style as shown or the regular grip style. The O-ring provides the seal for the handpiece coolant and should be replaced when worn out. The connecting body is different for each of our inserts, and this is the part that transfers and amplifies mechanical motion to the stack of the insert tip. The insert marking on the magnetostrictive stack allows us to know exactly the date the insert was manufactured down to the lot number. The magnetostrictive stack itself converts energy provided by the handpiece to the mechanical oscillations used to activate the insert tip. All these components together talk to and harmonize with the Cavitron unit. This is what makes the Cavitron system so superior to all other units on the market. It is important to note that the last 4 millimeters of a Cavitron insert is the actual active area on the tip itself, which adapts to the tooth surface to remove calculus and biofilm while scaling. As the insert is used, the tip will wear backwards, causing a loss of tip length, which translates into a loss of efficiency. The following will help you visualize the results of a worn tip.
Selecting the appropriate ultrasonic insert based on the type of deposit and anatomy can have an impact on scaling efficiency and comfort. Another key to optimizing performance is using a well-maintained ultrasonic insert. Did you know that the last 4 millimeters of the tip is referred to as the active area? This area is responsible for the removal of calculus and biofilm. As the tip wears from use over time, this lost length translates into a loss of efficiency. In this test, we compared a new Cavitron ultrasonic insert to a Cavitron ultrasonic insert with only 2 millimeters of wear. On average, the worn insert results in a 30% increase in total scaling time. In addition, a clinician will use 40% more scaling force over the course of the procedure. This may result in an increase in both patient chair time and pressure used by the clinician while scaling. What could you do with 30% more time? Check your inserts regularly to maximize efficiency and comfort for you and your patients.
It is recommended to measure your inserts monthly. In order for you to do that, you will need a Cavitron insert wear guide, as shown in the pictures here. At the blue line, the tip shows wears of 1 millimeter or 25% loss. The red line indicates a wear of 2 millimeters or 50% loss. Once it hits this point, it is no longer efficient and should be disposed of. This slide shows you the clinical implications of insert wear. After 2 millimeters, an ultrasonic insert has 59% loss of efficiency and causes a 30% increase in scaling time, plus 40% more scaling force is required as a result. This increases both patient chair time and pressure used by the clinician while scaling. Inserts fail for a variety of reasons. Let's talk first about improper insert selection for the type of deposit. We commonly find clinicians using the Slimline 10 as, quote, a universal insert. It gets used on all types of deposits, including moderate to heavy deposits. The Slimline inserts are not designed to be used on heavy calculus. Use a power line instead. It will be faster and your Slimline insert will wear less quickly. Be sure to follow the recommendations on what power level is appropriate for each type of insert. When reprocessing, handle the inserts with care. We recommend a cassette to protect the inserts while being reprocessed. If the tip is bent or the stack is warped, then the insert must be discarded. They cannot be reshaped or unbent. Do not use disinfecting wipes on the inserts, as it will dry out the O-rings and cause the inserts to leak. Follow the proper reprocessing instructions, which can be reviewed in the next slide. The most recommended way of cleaning your inserts is by using an automated cleaning method. It was once thought that you were not to place your Cavitron inserts into an ultrasonic bath. With the advancements of neutral pH solutions, it is now recommended to clean the instruments in an ultrasonic bath. Place the inserts in an ultrasonic bath for 15 minutes using a pH neutral cleaning solution such as Dentsply Sirona's Resurge solution, as shown in the next video.
The Resurge ultrasonic cleaner, coupled with Resurge instrument cleaning solution, provides superior cleaning power compared to the leading competitor. In this demonstration, we will show you how well the Resurge instrument solution removed protein, in this case, collagen from a film strip, compared to a leading competitor. Both baths were run for 10 minutes in 45 degrees Celsius water with a corresponding instrument cleaner. As you can see, after 10 minutes, the leading competitive system removed little from the film, while the Resurge system removed all the protein. Which system should you be using in your instrument cleaning and decontamination protocol? Find a new confidence in instrument cleaning with Resurge ultrasonic cleaners, featuring maximum cleaning power with Resurge instrument cleaning solution, optimum volume whether needing low or high capacity, touch control panel with countdown timer for easy control, low profile design with lid holder making it easy to see into and remove instruments, lightweight with easy to use handles. Resurge ultrasonic cleaners, delivering better, safer, faster instrument reprocessing.
Once you have finished cleaning the inserts, you need to rinse the inserts under running water for 30 seconds. Dry the inserts using a disposable lint cloth, and if using an instrument washer, follow the directions for use. Then place the dried inserts into a sterilization pouch or cassette and steam sterilize as manufactured instructed. I hope you have found this presentation helpful in knowing the proper ins and outs of the Cavitron unit and insert maintenance. If you need more information or you have any questions, feel free to contact me directly using the address on the screen. And thank you.